am Guillena from BSN2B2, and for today I'll be performing the unique demonstration of perineal care. So first is we have to identify the patient and introduce self and explain the procedure. So good morning, ma'am. I am Guillena from Southwestern University. I am a student nurse today, and for today I'll be performing your perineal care. So this is to prevent infection and to remove the small clinical odor and to prevent contamination. And then next is the after that we need to prepare 6 sterile sponges using an antiseptic solution or iodine and use sterile forceps. So that this is to ensure efficient cleansing while maintaining a sterile procedure. So the sponges are already soaked in antiseptic solution. Next is we then position the patient in a dichotomy position. This is to have an optimal access to the perineum for thorough cleaning. So the patient is already in a dichotomy position. Next is then we then wash hands. This is to prevent cross-contamination and avoid transferring microorganisms from one place to another. And next is to use sterile gloves, but I don't have any sterile gloves. Since I don't have any sterile gloves, they just use clean gloves first, but in the actual setting, we'll use sterile gloves.
Then position na tarong nga ng work formal sa sterile gloves. Tarong nga position ng worship sterile gloves ng cold siya. Before mo mag-perform, prepare ang gloves na for
we then take a new sponge from each new area and then do not go back to the already clean area with a new sponge. So 6 sponges are needed. This is to prevent contamination from one area to another. Start off using the zigzag motion from the clitoris to the lower abdomen just above the pubic hairline. This cleanses the suprapubic area and then prevents contamination before going downwards.
Here's na lang straight.
perineal muscle from the inner thigh over the labia majora. So just about halfway between the hips and the knees. This is to bring adjacent surfaces. And then repeat the process on the other side.
Which part mo ka nag-start?
Sa majora.
Lisod na naman siya.
Ha?
Asa man daw ka mag-focus sa kani or kani?
Reluction is repeat on the other side. Next is then apply a single stroke from the clitoris over the labia, perineal, and anus, and repeat on the other side. This one directional feeding ensures remove that we have to make sure that to remove the for contamination and to prevent spreading of germs towards the urethra.
So from the
Clitoris, labia, perineum, anus.
labia.
Repeat on the other side.
Okay, so unsa pa? Walhon ka or tuo?
Always.
Tuo. So dapat kung tuon ka, diri ka. Okay, para easy sa imong access, diri ka. So, diri ka. Okay. Sige, balhin diri para mas
Single stroke in the middle from the clitoris, vulva, and perineum. This is to ensure that the central area is doesn't have any contaminants and to minimize risk infection.
Sometimes in the sterile area,
After this procedure, we then remove gloves. So prevent transferring of contamination. And then perform hand washing to prevent transfer of contamination.